SARS, a disease caused by coronavirus SARS or severe acute respiratory syndrome, is a highly contagious respiratory illness characterized by a persistent fever, headache, and bodily discomfort, followed by a dry cough that may progress to great difficulty in breathing. Etiology. SARS is a viral respiratory disease of zoonotic origin caused by a crown-like coronavirus SARS-CoV, a type of virus usually associated with pneumonia and the common cold. SARS coronavirus jumped to humans from an animal reservoir, believed to be horseshoe bats, a bat family. Among humans, the virus is transmitted from an infected person through bodily secretions, usually droplets expelled by sneezing or coughing. It might also spread by hands and other objects the droplets has touched. Epidemiology. Severe acute respiratory syndrome (SARS) originated in southern China in November 2002, and was brought to Hong Kong in February 2003. From Hong Kong, the disease spread rapidly worldwide but mostly to Asian countries. Pathophysiology. Severe acute respiratory syndrome (SARS) is a serious form of pneumonia. Infection with the SARS virus causes acute respiratory distress, severe breathing difficulty, and sometimes death. The lungs and gastrointestinal tract have been demonstrated to be the only major organ systems that support SARS-CoV replication. After establishment of infection, SARS-CoV causes tissue damage by 1. Direct lytic effects on host cells, 2. Indirect consequences resulting from the host immune response. Autopsies demonstrated changes that were confined mostly to pulmonary tissue, where diffuse alveolar damage was the most prominent feature. Angiotensin-converting enzyme 2 (ACE2) of renin-angiotensin system was thought to be a major contributor to the development of this damage. The other mechanism was thought to be the induction of apoptosis. Incubation period. The average incubation period for SARS is 4 to 6 days, although rarely it could be as short as 1 day or as long as 14 days. Signs and symptoms after the virus incubates. Initial symptoms are flu-like and may include 1. Fever that remains above 38 degrees Celsius (100.4 degrees Fahrenheit), 2. Muscle pain, 3. Aches and discomfort, 4. Cough, sore throat, and other nonspecific symptoms. SARS may eventually lead to shortness of breath and pneumonia, either direct viral pneumonia or secondary bacterial pneumonia. Diagnosis. SARS may be suspected in a patient who has 1. Symptoms, including a fever of 38 degrees Celsius (100 degrees Fahrenheit) or higher, 2. Either a history of eye contact, sexual or casual, with someone with a diagnosis of SARS within the last 10 days. Travel to any of the regions identified as areas with recent local transmission of SARS-3. Positive serological tests like ELISA, immunofluorescence or PCR. Treatment. Antibiotics are ineffective, as SARS is a viral disease. Treatment of SARS is mainly supported with 1. Antipyretics, 2. Supplemental oxygen, and 3. Mechanical ventilation as needed. Antiviral medications are used as well as high doses of steroids to reduce swelling in the lungs. Prevention. There is no vaccine for SARS. Isolation and quarantine remain the most effective means to prevent the spread of SARS. Other preventive measures include 1. Hand washing, 2. Disinfection of surfaces for fomites, 3. Wearing a surgical mask, 4. Avoiding contact with bodily fluids, 5. Washing the personal items of someone with SARS in hot, soapy water, eating utensils, dishes, bedding, etc. Latest researches. In late 2019, Chinese researchers identified a new coronavirus, subsequently named 2019 nCoV, which had been isolated from a patient with severe pneumonia who was hospitalized in Wuhan. By the end of the year, infection with 2019 nCoV, which caused a SARS-like illness, had been confirmed in more than 40 individuals in China. In early 2020, health authorities reported a case of illness caused by 2019 nCoV in a woman who had traveled from Wuhan to Bangkok, the first case reported outside China. SARS originally isolated from bats, raising concern that 2019 nCoV represented a global disease threat, similar to the SARS coronavirus that caused a pandemic scare in 2002-03. Remdesivir is a drug developed by Gilead Sciences for NCOV, an American pharmaceutical company. Hopes have been pinned on the drug, but we have to wait for results of its actual effectiveness in the clinical trials. Subscribe our channel for more videos. Thank you.